Experiences and Lessons Learned from COVID is next. I'd like to introduce our panelists. I've invited some representatives from the broad community in the greater Boston area, close to home and a little further from home. Tolga Durak is the Managing Director of MIT's Environmental Health and Safety Office. Peko Hosoi is a faculty member of Mechanical Engineering and also the Associate Dean of Engineering at MIT. And Robert Sege, Professor of Medicine and Director of the Center for Community Engaged Medicine at Tufts. And we'll invite them to have a conversation. We'll ask them first to do a little bit of a self-intro with some prepared slides, and then I will frame the panel discussion with some words harking back to some history. And I will be the slide advancer. So with that, Tolga, Peko, Bob, welcome, and I'll turn it over to Tolga first for a little bit of self-introduction and framing of his perspectives in the response to COVID at MIT.
Thank you, Brian. And I should start by saying that I'm delighted to be a part of this event and this panel with such impressive group of esteemed colleagues. And maybe it would be helpful for me to take about 30 seconds to give you a snapshot about the MIT EHS Management System first. So in addition to the robust, it's about 70 subject matter experts in the central office, coupled with as many embedded safety professionals, along with around 860-ish EHS representatives that are housed in departments, labs, and centers. So during the COVID crisis, some of the activities that we have been involved, and maybe this will kind of provide a framework for some of the discussions later on. During the pandemic, we led and partnered on several activities on campus. Our Lean Lab project in partnership with Yellow Box, Clean Room, and Media Lab continue to demonstrate how Lean principles can shine during regular times, but also really shine as well during the crisis period as well. We started a new initiative to support remote work, to address general safety and ergonomics challenges. And we have really gotten a great feedback as we support our community at large. We mass-produced hand sanitizer in our lab to support our community during the time of shortage. And we still continue to produce this hand sanitizer and provide it to our community. We assisted in several novel solutions to address PPE shortage and challenges with rapid design and deployment of testing facilities around campus. And last but not least, we partnered with MIT's Project Manus to enable safe remote making through wikis, frameworks, and classes.
Let me just give you a quick overview. So I wear many hats at MIT, but the one I'm going to wear today is as an affiliate of IDSS, which is the Institute for Data Systems and Society. And when the pandemic broke in March, there were a number of us that got together to try to figure out how we could pull our expertise together to help. And IDSS is a group of faculty who have expertise in data analysis, but then also on the society side, expertise in policy and implementing interventions and quantifying what are the impacts of those interventions and policies. So for COVID, we've been looking at how do we blend all of the possible levers we have to control the spread of the virus, which includes things like masks, it includes things like testing, contact tracing, ventilation. How do we integrate those into a system and choose how to implement all of the different pieces in a way that is tailored to individual organizations? So, we've met with state governments, with governments of countries, with different industries. The question I get most frequently is people tell me, okay, Peko, we know we're supposed to wear masks at this point. We know we're supposed to be doing contact tracing. We also know we're supposed to be doing testing, but we have no idea how much or what kind of testing. So lately we've been doing a lot of work to give people some guidance and provide tools so that organizations and governments can make rational decisions about how much testing they should be doing and what parts of the population. And so that's work that we're doing in collaboration with NIH and their RADx group. RADx is Rapid Acceleration of Diagnostics. And that tool is going to be made available at the end of October, which should be able to provide some guidance for schools, businesses, communities, nursing homes, et cetera. So that's sort of the context that I'm coming from, and I'm excited to be here.
I'm Bob Sege. I'm here from Tufts Medical Center, where I'm the Director of Community Engaged Medicine. And what I and my team have been working on are what are childhood experiences, what are children experiencing during COVID? Because we know that children's experiences are both different from the experiences of their adults, and also extremely important as childhood experiences, both positive and adverse, affect them throughout their lives. And I'm going to go through really quickly and give you a little background on that. So if you can go to the next slide. This is my MIT connection. This is a picture of me as a graduate student with my advisor, Monty Krieger. I've moved out of the lab. And on the next slide, we can see that one of the things that people have been concerned about since the time of W.E.B. Du Bois is what are the environmental effects on children as they grow up. The larger picture on the right is his hand-drawn sketch of a neighborhood in Philadelphia around the turn of the 20th century. And on the left is a computer-generated map of lead levels in children in Philadelphia. So environmental factors have been important for child development. And then we can see on the next slide that we're now able to use child development assessment and map it back to the neighborhoods where children come from to try to figure out what's going on in the environment that produces children that are ready for kindergarten. This slide, taken from New Brunswick, is something called the Early Development Inventory, which is done at the time of kindergarten entry and shows children's social, emotional, and academic preparation for kindergarten. The next slide looks at what are adverse childhood experiences. And in the 20th century, it was shown that exposure to child abuse, child neglect, or household dysfunction had long-term consequences on adult health. In a 2019 paper, the CDC showed that about 1 in 8 adults with chronic heart disease, the most common physical chronic disease in the United States, is due to adverse childhood experiences, and 4 out of 10 adults with depression, the most common mental health problem in the United States, are due to adverse childhood experiences. But as you click through, it turns out that this was done in the 20th century, and now we've come to understand environmental influences. So things like poverty, if you can click on institutional racism, historical trauma, war, migration, and neighborhood effects all have adverse effects on children. And then the next slide is our group has done research that shows that children's brains respond to other environmental influences to positive childhood experiences. And these positive experiences can break the chain between adverse childhood experiences, what's called toxic stress, or what happens when a child is exposed to chronic and unmitigated stress in a high-threat environment, and help healing when toxic stress does occur and prevent adverse health outcomes. So if we want to go to the final slide, what we've been reflecting on during the time of COVID is really simple. What are the adverse experiences that children are suffering, and what are the positive experiences that they're also appreciating? And I think that we've discovered that from a child's point of view, the epidemic is quite complex, because for some children, they're getting more time with their parents and family, less time pressure on everyone. And up until recently, many families were buffered from the economic dislocation through generous unemployment benefits. So we're very interested on figuring out what is the balance, because the only thing that we know for sure is that what children experience now will last them through their whole lifetimes.
Bob, thank you. Tolga and Peko, thank you very much. We can take the conversation any way we want it, and if we can bring the panelists live on screen now along with me. What I will do is let me give a little bit of a history blurb as we have through the several days. Maybe it's to frame the panel, and then we can take questions from there. So harking back to 1918, the Spanish flu. How did healthcare change after the Spanish flu? In many Western countries, there was actually a turning away from science after the pandemic because people were disillusioned. From the 1920s, for example, in the US, alternative medicine took off in a big way and spread around the world, turning a little bit away from sort of science-based medicine. But at the same time, in countries that had not previously really embraced the scientific method, you see the opposite effect. China became a little bit more scientific after the pandemic. There's a little bit more of a move to better understanding of the disease surveillance, better public health, more organized collection of healthcare data. They saw that to prevent future pandemics, they needed to turn towards science. It gave a big boost to the concept of socialized medicine and healthcare, which no country had really gotten around to organizing yet. The pandemic is what gave the stimulus to do that, because there was a realization that a pandemic was a global crisis, a global health crisis. You had to treat it at the population level. You couldn't treat individuals, and you couldn't blame individuals, and you had to treat it at a population scope, not in isolation with individuals. Therefore, in addition to socialized healthcare systems, it generated the science and study of epidemiology, searching for patterns and causes of effect in healthcare data. The baseline health of populations started to become more visible and transparent. And now we have COVID in the near term and possibly in the long term. So that's sort of a little bit of the history, whether we want to take it as a framing or not. But the challenging question maybe that I'll ask to start is history repeating itself? Or what are we relearning, or what can we learn from looking back to 1918, and how do we not repeat our mistakes?
I'm going to just give a resounding yes. So, I'm obviously not an expert on the Spanish flu, but we're all turning into armchair epidemiologists during this pandemic. And one of the things that has been really surprising to me is when you go back and read the literature of the Spanish flu, all of the interventions are the same, right? It's masks, it's social distancing, it's don't get in large gatherings and parades in Philadelphia or whatever that was in the Spanish flu. Those were all things that were well known 100 years ago, and it's the same interventions that we're doing now. And if you look at the sort of the curves, the case curves from 1918 and the case curves now, and you look at when the interventions were applied, they look the same. So I think, yes, history is repeating itself. On a little bit more of a positive note, so Brian, you mentioned that there was this sort of backlash against science after the Spanish flu. Today, I find that the reaction, it depends a lot on which population you're talking to. And the people I find who have taken just a really sensible, practical approach to this are the implementers, right? So there are people who are charged with things like bring the students back to school, reopen the restaurants, reopen the economy. And those are people who I think, at least in my experience, have taken a very clear-eyed view about what needs to happen and how we can actually start to ramp our activity safely. At least that's been my experience, sort of boots on the ground at MIT and with sort of the governments and the industries that I've been interacting with. I don't know if Tolga and Bob have had different or similar experiences.
Peko, I really appreciate what you said, that we are in many ways repeating what happened in 1918. There is, of course, one difference. The influenza virus that afflicted people in 1918 was isolated in 1936. We've been a little faster with COVID-19, fortunately. But I think the other thing that I want to point out is that for all the reasons that you just said, the influenza epidemic in 1918 affected impoverished people, people living in substandard housing, who weren't able to isolate at a much higher rate than wealthier people. And I think that unfortunately we're seeing that same issue of inequities, both in terms of housing and who are the essential workers who don't get to stay home and work from home in isolation. And unfortunately, that part of history has also repeated itself, and it's in my mind a shame, because we know better than that, and we certainly know how to protect people.
Yeah, actually, let me just build on that, Bob, because I think what you said is exactly right. And if you look at sort of economic indicators, so you find out who is most at risk. One of the things that's correlated is number of people in a household and economic status, right? So if you are if you're less wealthy, you're more likely to have more people in the household, which means that you're more likely to spread the virus. And what that means is that that's where we as a country should be deploying our resources, right? If we have testing resources, that's where the testing resources should go, not to people who can already easily isolate themselves and are less at risk. So, I think there's a really interesting calculation that can be done to say, okay, if we have this much money that we're putting to mitigate the spread of the virus, right? We can give it out and send $600 to everybody, or we could say let's target some of these communities that are in trouble and give them the testing resources they need so that they continue to work safely, right? And I think those are hard policy questions to implement, but I think it's not so hard to actually compute what would be the optimal solution at a country scale.
Yeah. I think the other thing, and we'll probably get into it later, is these inequities also carry through to children, so that schooling and all of those things are other issues that we're beginning to see a growing inequity. So one of the things that many of us in child health are concerned are the ripple effects after the biological danger has passed of what's happening to children and families and the way our society views itself.
So let's take that conversation then and let's get to the children, but let's start with the adults for a moment. And I'll start with Tolga in terms of what's the impact of, I guess, two questions. The impact that we're having on our workers, our employees, and as in the jobs that they're still trying to do, whether it be remote or in a socially distanced physical presence. We didn't have an EH&S back in 1918, at least that I'm aware of it. How is it impacting the way that we work? And then we'll sort of move that as well to the impact on our children.
Sure. As you said, there are a couple different impacts. I guess the globalization is only elevating and escalating the spread of virus. Maybe that's something to think about as a contrast to how things happened in the past. But also pandemic, maybe, I don't know if it is logical to put this as a positive, but you can tell that now everybody, young and old, have a high level understanding of pandemic and how it actually impacts. There is really heightened level of awareness in most of the populations, and even people have new words in their vocabulary. Outside of people in certain industries or fields, people didn't know what PPE was prior to COVID. And now it's a part of the daily vernacular. So there is a shift in change and mindset and thinking. And maybe this coupled with the new, better and higher norm for personal hygiene, it is reasonable to make an assumption that maybe the transmission of or the spread of flu and other diseases with the main mode of communal transmission, maybe we're going to have less and less of it just as a result because people have more awareness. Once again, I'm playing the armchair quarterback here as well. I am not, I don't have any expertise in epidemiology, but the question on the impact of our work is a really distinctive one. And I think it really ties into diversity and equity and equality a little bit. So maybe one of the things to think about is that the new work environment is, especially the new remote work environment, is causing a lot of different challenges. In a regular fixed workspace setting, you have interventions, you have controls. And now we don't. So the health and safety programs are going to have to pivot. And it is, the disparity is really blatantly obvious for most of us, especially if we're in it. And in addition to having workstations that do not fit to people, the environment and the scheduling is not really conducive to high performance environment, but also sometimes simply not healthy. The Zoom fatigue is real. I think we can all agree. And virtual environments are often more demanding, and people are anticipated to be available around the clock with less breaks. And once again, as one of my former coaches would say, some people are more equal than others. So the impact is simply inconsistent across the board. So what does that mean for common workspace ergonomics programs? What does that mean for injury and illness prevention, musculoskeletal issues? These are stuff that we need to think about.
And the same issues apply to the learners. So I guess the thing that would add is sort of talking about those same issues with the learner, but how do we also instrument the system so that we can understand the impacts? And I'll go to Bob and Peko now as well.
I think you just asked a really hard question, Brian. I think instrumenting the learning system is a question that we've had even in the absence of COVID, right? So, I think we're constantly imagining ways that we can improve the educational experience. And the question we always ask is, but is that thing did that thing do any good? And it's really hard because there are so many variables that it's tough to control which variables you're changing. I'm gonna let Bob answer that because I'm not sure I have a good answer for it.
I'm just going to pick up a little on what Tolga said. I think the work environment is complicated because, again, it goes to equity issues. If we work at home, and we're lucky, we're empty nesters, we've got lots of space to kick around, have a nice workstation. Other people, not so much. So as we move to home, there are equity issues. And the answer to the question about instrumentation, I think this kind of goes to the heart of it because we are going to be doing more virtual work. We're going to be doing more virtual learning and understanding how we pay attention, or what we attend to, what sticks, what doesn't, what works really well virtually, and what we really need to be in person. It is important going forward because we've had to switch from virtually 100% in person to virtually 100% virtual. And it's obvious to all of us that some things work really, really well virtually, other things don't. And how we begin to see.
I'm going to interrupt for one moment. So, Bob, sorry. Your audio, I'm not sure where the connection is breaking, but your audio is extremely choppy. So I'm not sure if it's on your side or someplace over the Ethernet.
Okay.
The technical staff here says it's the internet connection. So maybe with that pause, why don't you try? Okay, we're taking a momentary break, so we'll bring the panel back here in a second. Okay, Bob, let's see how you're sounding now.
Again, if not, I'll do phone audio, I guess. Is this better?
No, it's not.
Hey,
It was fine, and then it dropped out.
Yeah, it's all Comcast's fault. You know that.
Okay, we're gonna we'll pause you. We'll ask a different question. We'll give the internet a chance to stabilize here. So we don't know how to necessarily instrument the system, whether it be on the learner side. But I think, what are some of the other ways that we should be instrumenting either our homes or our workspaces? I know that, Tolga, you've thought a little bit about that, which is why the question comes to mind. How do we, maybe not on the individual only, but in the workspaces that they're in, how do we start to get some of this sort of real-time data that tells us something about how we're interacting with our worlds?
I am not really sure how exactly yet. And I think this is really not a surprise to you given some of the recent conversations, but I think there's quite a bit of opportunities. Before I get in there, I wonder if I might have jinxed the situation talking about Zoom fatigue. And I can't help but wonder if I am the cause of it. But that aside, I think there certainly is some opportunity to explore the potential impact of leading indicators. Maybe a posture is a good one. I know, Brian, this is one of your ideas, quite frankly, the impact of posture on general health and well-being, injury and illness reduction, maybe the overall, and we know, to Bob's point, the remote work environment is here to stay for a while. And it is safe to assume that there will be some lasting changes post-COVID in terms of how we operate and what the new definition of the workspace is and what the new normal is. But one thing, at least for the purposes of EHS programs, we really should be thinking about how to explore the overall impact of some of these changes and position the programs in a way that they're malleable and able to pivot as needed to meet the new expectations. And we try to really delve into that a little bit at MIT with some of the support that we have provided to our community in the form of training, in the form of some intervention, one-on-one consultation and experiences of workstation design. I would like to think that data is going to be the next phase where we really start collecting some empirical data, some information to enhance our informed decision-making abilities.
Actually, hey, Brian, if we're talking about instrumenting the environment, if I could wave a magic wand and get one piece of information, I would like to get instantaneous flow fields from the ventilation. Right. I think, currently we're doing a lot of ventilation calculations, but you have to do them in an average sense. And I think we have data, for example, from the Wuhan restaurant, from the restaurant in Wuhan, which shows that the direction of the flow is important, right? You don't want people sitting downwind of anybody. And when there are people in a space, it can dramatically change the flow field because all of us are little heaters that are sending up a plume of hot air, which changes the circulation, the circulation of the air in the room. So if we could get instantaneous snapshots of what the flow field is in a room, if that was something that was easy to do and we could actually put some feedback in a system to move people around, that would be amazing.
Interesting idea. Bob, I just want to see how your audio is doing here.
Brian, I switched to phone because I don't know what's going on, but my internet says it's working, but it's not. I just I think what I was going to say is the other thing to instrument is we know that brain scientists can look and see what people are attending to. There's all kinds of techniques now to better understand how we pay attention, what matters and what doesn't. And I think we have an opportunity now to really improve virtual learning and virtual work. Zoom is great, but there's room for improvement everywhere. And it would be very interesting to begin to really optimize the environments that we work and learn in.
Actually, one other thing, I don't know if this is instrumenting, but this is data I wish we had, which maybe we can infer, but it's a little bit tough. It would be great to actually know the local prevalence of the virus, right? And the challenge with that is that to really do it right, you need to be randomly testing the entire population because there are so many asymptomatic people. So you can probably get some idea from the Iceland data. MIT, I think we're now getting some information there because we are randomly testing the entire population on a very rapid timescale. But in general, across the United States, it's very hard to do because you're primarily testing people who are symptomatic. So your sample is really biased, and it's hard to know how to correct for that bias without having a real random baseline. So I think having really good data around that would be enormously helpful.
So natural in the environment, either on surfaces or in air, is what you're thinking there? No,
I'm talking about people. The number of cases. Okay. Who has COVID, right? Because right now the case counts are biased by the fact that in most of the country you're primarily testing people who are symptomatic, right? And we don't know right now what fraction of the population are symptomatic or asymptomatic or how that breaks down by age group. right? So we can't do the correction to figure out how prevalent is the underlying disease.
No, it's interesting. The best way we have to look at that now is looking at wastewater.
Wastewater's great. Yeah, wastewater's fantastic. Yeah, actually, I just got excited about wastewater, but Bob, go talk about wastewater.
No, because the virus is shed in feces, so you can tell when you measure wastewater what the population prevalence of the virus is, and some universities have done that to look at dorms and that sort of thing. But I think that's an underutilized technique we have. We're very cheaply and very quickly assessing viral load in different areas because we have, wastewater systems that are obviously geographically bound.
Yeah, I totally agree, and I think there's lots of opportunities to implement that on different scales, right? So right now it's being tested at Deer Island at Massachusetts, which is a larger scale, but you can also do it at the scale of a building, which is there's some pilots being done at MIT right now. So I think I think like Bob said, that's a really exciting and underutilized technology.
The other thing I like about it is it doesn't require anyone to volunteer to be tested or any of the things that are involved, and people don't feel invaded. It's literally a waste product that's tested.
Yeah.
So we need some very smart toilets and very smart
exactly.
plumbing systems.
Exactly.
Yep.
Bob, let me take it back for a moment to, I know you've been thinking deeply about sort of the impact on the young learners. I have 3 young children, and I see the struggles that they're going through just trying to do remote learning. And some days it's smooth sailing, and other days it's just screaming and crying. But how do we, I guess, appropriately instrument or protect, and what are the long-term impacts that we need to be most cognizant of that we can try to put in some remediation now, even when we're sort of constrained to being remote in our learning?
Well, I think that one of the things is that we always think about learning as being primarily academic, and that's difficult enough remotely. And certainly some children have an easier time with that than others. So, and some of us have easier time with it on some days than others. But the other part of what we learn is more social emotional development. And that happens through being with other kids and peer development and all those small and large conflicts that we have with each other, where we learn to develop what the psychologists call a theory of mind, which is simply the idea that other people have brains and personalities and wants and wishes just like we do. And that's a developing realization in young children. So I think that whatever we can do to allow children to play together, to have some fun, to get physical space, keeping in mind that the virus is way less dangerous for young children than for old people who are like 11 and up. So I think it's really important. And then as far as the remote learning, at the very basic level, making sure that everyone has internet access and a device to connect to it, and a place that's quiet and they can focus is really important. Beyond that, I think we're going to need to learn what can be done most effectively online. What really do you need to bring kids in periodically to have a teacher look over their shoulder and figure things out. So I think that we have a long way to go. One of the measurement issues that we're really struggling with in child health is we know children don't get sick very often from COVID. We suspect that they're not very efficient at transmitting the virus. And there's a lot of data about that. So if we knew better, we could do a lot better at making more informed decisions about in-person learning when that needs to happen, because it does need to be more effective.
Hey, Brian, can I follow up on something that Bob said, which really resonates with me, which is this is an opportunity for us to take a long, hard look at what can we do online and what can we really not do online. And I think that's true not just for the younger generation, but we're obviously struggling with that at MIT as well, to understand where is the real value add in the personal interaction. And I think that education is an area that it's fairly stable. So there's not a lot of large, sort of momentous changes. And this is an opportunity for us to really look hard at what we do and decide if we're doing things in an optimal way or if we need to do things differently. I think Woody Flowers has some really nice TED Talks about this and what he terms training versus education. And the education is sort of what he views as almost an apprenticeship. So where do you really need to have that interpersonal interaction and have the interaction with an expert and a novice? And where are there skills that you can pick up by doing a tutorial or learning something online? That sort of training piece is a piece that you can commoditize and that you can scale, and you can send that sort of all over it, as far as we want to go with the technology we have. The education piece, which requires that interpersonal interaction, is much harder. And I think we have to think about, where is our value add there, and how do we divide that up?
Trying to be optimistic, it really is exciting, because if we can figure out ways that the people can learn and work effectively remotely, we can be much more effective and bring much larger communities together across cultural and geographic boundaries, which would be absolutely spectacular. And so I'm optimistic that in 5 or 10 years, we'll have figured something out. And of course, what I worry about as a pediatrician is today's 5-year-olds need to learn how to behave with each other, and today's 6-year-old need to learn how to read. And there's a lot of scientific data that there are developmental windows for those sorts of things. So how do we make sure that those children don't get left behind while we move to what I think is going to be a much better system in the future?
Yeah, and the virus is basically a forcing function for that, right? I mean, we can't. Business as usual doesn't work, right? So it's giving us a kick that we probably needed.
So I know this isn't necessarily your individual areas of expertise, but what I'm hearing is sort of resonating with some other conversations I've had with companies that are focusing in virtual environments, virtual reality, and gaming. So I'd like to pose to each of you, what do you see as the role of I'll call it gaming, but sort of something that is better than Zoom or virtual interaction, whether it be in the workplace, in the classroom, in the homes. I'll start with. I'll take volunteers first before I voluntold.
Well, maybe I'll chime in, because this is something that we have been thinking about. As one can potentially imagine, training on compliance is not necessarily the most exciting thing. So we're always thinking about how can we simulate some dangerous situations, which basically is not easy to do without putting someone in harm's way. And how can we enhance our training? And we have been really thinking about using game theory, AI, AR, and VR, and even the notion of creating games to substitute some of our required compliance training and additional elective training. And this is something we actually, I'm excited to say, this is something that we're probably going to start really looking into, maybe piloting and determining if the opportunity is there. But I would like to hope and assume that there's really a pathway moving forward for that.
Yeah, I think that's super interesting. Red Bull is actually doing some really interesting things in training their extreme athletes to do exactly what Tolga said, which is to give them the perception of danger. So so these are athletes that are often in very dangerous situations, and so you want your brain to react in an appropriate way. And so in the training, they need to put them in situations where the perception of risk is very high, but the actual risk is not. Right, so they have some interesting ways to do that, to sort of trigger a fear reaction, but still keep the actual danger level low. So I think that's super interesting. The other thing, Brian, is I totally agree that in education we need to be talking to game designers. I think game designers they have a really good understanding of how to keep us engaged, right? I grew up when everybody was playing Civilization in college. Probably nobody here remembers Civilization, but the conversations would be something like this. you would come in and say in the afternoon and say, you know, hey, do you want to work on this piece set? And your friend would say, yeah, just give me an hour or two. I'm about to get railroad. And then you would see them 2 days later, and you would say, what happened? And they're like, has an hour passed? Right? I mean, the game is designed in such a way that you are just constant. You just always have that next reward coming, right? And I think you can't do that in all parts of education, because there are times when you really need to engage a different part of your brain and dig in deep. But I think that this idea of keeping people engaged is something that we don't use enough now, and I think there is a lot of expertise in the gaming industry.
I just want to build on that. I think that in education, there's going to be a big future for virtual reality and augmented reality, because we'll be able to interact with each other and with the environment in ways that you can't really do now. We're beginning to see through games how that works. And of course, the computer I'm using now probably owes a lot of its development to people who were gamers in the past, who wanted that high performance, minus the internet problem. I think that the other issue here is that there is an equity side to this, which is really interesting. We've been doing a lot of trainings now on Zoom, and it's possible to do polls and chats and all kinds of things where you don't know the discipline or the level and the hierarchy of individual respondents. And when you're in person, it's pretty easy to tell who's young, who's old, who's sitting in the front row, who's not, all of those things. And I think that there's an opportunity to use these interactions to really promote a more equitable working and learning environment. And I hope that we can pull that together as well, because there's a lot of untapped potential because people know their, quote, know their place, end quote, and don't offer their opinions or are overly deferential when they probably shouldn't be. So I'm optimistic that some of these things will be worked out, but we really have to work very, very hard right now to make sure that every child and family has the technology that they need to participate in the economy safely and to participate in schooling safely.
Yeah, and actually to build on that, I think we've seen something very similar, which is that in the large classes, we actually see more engagement in the chat, right? Because I think students, if you're in a class with 500 people, you don't want to be the one to put up your hand and stop the lecture, right? Whereas in the chat, you can do it without disrupting what else is going on, and so people feel more comfortable doing that. So yeah, I think one of the requests we've had is, when we go back to doing sort of normal things normally, can we keep the chat? Like, is there some kind of a version of a live chat that we could have in an in-person class? So I think we are accidentally finding some of the features which are actually better than what we've done in the past.
That's going to bring me to, we're getting close to the time here. Let me do another round robin question. What do you see, what have you learned or what have you observed that's been most surprising? And that can be a good surprise or a bad surprise as you've been in your roles, doing your work, addressing these issues. What's been the most, oh, oops, or oh, wow?
I'm going to answer a slightly different question, which has been the most rewarding, which I think has also been a little bit surprising. But I think one of the things that I've found, this is now wearing my associate dean hat, in just getting things back up and functioning during a pandemic is there are a lot of unusual connections that need to be made that you wouldn't necessarily have to do, right? So we have a lot of, like, the gears normally just turn and things work, and you don't necessarily know how all parts of the institute function, but they function. And what I've found during this is that to really, to understand how do we get the students on board? How do we coordinate testing? What does this mean in terms of mask wearing? Can we open up these spaces? It's meant that I've gotten the opportunity to interact not sort of just with my collaborators that I would normally work with and my students, but also with facilities and with the Dean of Student Life and with different student panels and with the dining facilities. And it has been really fantastic to see how all of those pieces come together. And, sort of from a systems engineering point of view, it's actually a really interesting problem to understand the trade-offs between all of those moving pieces. and to get everything to work in a new equilibrium. So, I mean, that to me has actually been extremely interesting and extremely rewarding.
So, I'll certainly take Peko's lead and answer a different question if you'd like. But,
Well, I would say it was somewhat surprising, but maybe more reassuring to see how everyone, I mean other peer institutions, had almost identical challenges in pretty much all aspects during this pandemic, despite their size, their resources, how prepared for emergencies they appeared to be prior to the pandemic. So it was kind of really refreshing to see that there was a camaraderie, and I think that really helped a lot of us. It was helpful and comforting to see how all the peers were willing to share information, tackle things jointly. You saw a lot of things that took place at state level, from testing efforts to novel designs. There was a really sense of community and collaboration, and it was gratifying to see how some of the folks who were given charges and tasks outside of their span of control really rose to the occasion. I would also say that those very few instances where individuals or institutions try to do things in isolation by themselves, they did not end up succeeding as well or as fast. Not a surprising outcome, but still something to take account.
So I think that I had two kinds of surprises. One I've mentioned before, the issues of the inequities in society have become so much more apparent and literally a matter of life and death, and certainly a problem for child development. On the other hand, my team and I have been virtually around the country and done workshops and all kinds of things with people in various different parts of the country. And I've been overwhelmingly surprised at how adaptable people and families are, what they're doing for their own children, what they're doing for children in the community. In one rural school district, they're delivering food by school bus when the schools were shut down because families and kids needed food. Other areas, they've managed to figure out how to keep the kids engaged. And many families are actually finding that the hours they're not spending commuting are family time. And I'm just hearing all these really cool stories. I think that I had completely underestimated how adaptable people are to literally changing our life in a week. Everything shut down so fast. I think we're going to get through, and that adaptability is going to be really important. And I hope that we're using this opportunity to really take a hard look at society and deal with some of the inequities, because we don't like it from a value point of view, and we're a rich country. We don't have to have it. So I'm really optimistic that those two realizations will come together.
Let's hear it for the adaptability of humanity. So the last question, real quick, round robin, the burning point or cliffhanger question. What is the one burning idea or concept or lesson that you want to share and you want people to reach out to you to further discuss? We can go in reverse order here. So maybe we'll start with Bob.
I think the most important thing for that people may want to reach out to me is that children learn from their experiences, and it literally affects their brain development. So what can we as parents, as society, do to protect children from adversity, and equally important, to make sure that they're engaged, that they have a safe environment, that they can learn, and that they'll have stories that they'll tell their grandchildren that will make everyone laugh. And that's what we need to have.
Yeah, so for me, I think what people can reach out to me on is the work we've been doing about how to layer the different types of interventions in a way that is tailored to your organization or your community, right? So so right now we've got a slew of recommendations coming at us about masks and testing and ventilation. So how do I layer all of those things in a way that makes the most sense for the culture and the community that I'm embedded in? Anything from the level of small organizations all the way up to the size of countries.
I would maybe look at it from a much more specific lens as far as EHS programs. And maybe the notion would be beyond compliance. To me, EHS programs are unique in the sense that it is a proverbial bridge between academy and administration and higher ed, research and operations and private sector. The high-functioning EHS programs are deeply integrated with research, teaching, and they promote a safety ecosystem rather than a traditional compliance-centric approach. It's a little nuanced, but I think that's where the biggest difference is, safety versus compliance. At MIT, we don't lead with the pointy edge of compliance and treat every interaction as if it is a task of completing a checklist. We build partnerships, we engage with our community, and work together to achieve a safe environment. And compliance is an automatic outcome. In that sense, we always take the notion that we strive to enable and catalyze safe research. And we actually do some of the research ourselves. We always take the stance of partnership. And some of the projects that I mentioned, whether it is the remote teaching and learning and remote making to some of the things that we have done in our lab, these are all a potential outcome. And I would say that it is affirmation that even in the crisis, the approach is valuable and valid.
Very good. Thank you very much for your time and for the work that you're doing and for your sharing your wisdom. So Tolga, Peko, and Bob, thank you very much. And that concludes our panel for today. And that also concludes the 2020 SENSE.nano Symposium. I thank you for your time and attention. I hope you found some wisdom and some value and some lessons learned as you heard about the body at all scales, from the cell to the organ to the person to the population, and sharing a little bit about the impact on our various systems, how we can innovate to bring technology out of the lab into the world. And I look forward to hearing your reflections, hearing your comments, and a resounding thank you and a resounding please stay safe and have a good day, evening, or morning. Thank you.